Hello and welcome to the next instalment of our A to Z on general podiatric complaints and conditions. Remember to keep an eye on NK Sports Podiatry Facebook page for their A to Z of MSK, podiatric complaints and conditions. And today is the turn of P, and I will be talking about peripheral neuropathy. And that is a loss of sensation or altered sensation in the terms of podiatry. It's within the feet, and that can be anything from numbness, tingling, pins and needles, a changed sensation, so something feeling cold when it should feel hot. It can also be a loss of balance and muscle weakness. Now in clinic I usually see this in my diabetic patients. It's a known complication of diabetes where the diabetes actually affects the nerves to the feet. But it can come from other causes. Stroke can cause it, spinal injury or spinal operations, and even sciatica, if it's long-term, can cause some peripheral neuropathy in the feet. It can also be due to B12 deficiency, liver disease, commonly alcoholism, and some medications, autoimmune diseases, and unfortunately age-related peripheral neuropathy as well. And something we are seeing coming through more and more is chemotherapy-related peripheral neuropathy, so that is a big one. And it's estimated that actually 1 in 10 people over the age of 55 in the UK have some degree of peripheral neuropathy. And depending on the cause, you may get some improvement with it, but it does tend to be a long-term condition. And the complications, well, if you can't feel your feet, you don't know whether you've got a wound on your feet, you don't know whether you've cut them, they could get infected, and this is why we're getting lots of diabetic amputations, because they can't feel their feet, they get cuts, ulcers, infections, and it does lead ultimately to amputation. But also with the muscle weakness and loss of balance, you get increased risk of falls and difficulty walking, and of course that affects us quite a lot. So what can we do? Well, manage any underlying condition. If it's diabetes, try and control your diabetes, live a healthy lifestyle, reduce the alcohol intake, stop smoking is a big one, and exercise, get that blood flowing to your feet as much as possible. If it's a nerve compression issue, try to reduce the compression on the nerves, and that may actually require surgery in some cases. But what can you do if it is painful? Well, painkillers basically. Some anti-seizure and antidepressant medications can help with some symptoms of painful peripheral neuropathy. You can get creams which are made of hot peppers, which can help increase the blood flow and can help with that as well. There is electrical nerve stimulation which may improve the symptoms, and physical therapy if you have the muscle weakness to help you walking. There are falls clinics run by the NHS now which can help with that as well. And as I say, sometimes surgery may be an option. So peripheral neuropathy is a big thing and it does have to be monitored. So if you are suffering with any changed, altered or decreased sensation in your feet, please go and see your podiatrist as soon as possible. We can assess you and we can let you know how bad it is and if there is anything you can do about it. Now, if you have any questions, comments or queries, please pop them in the comments below or feel free to message me directly. Have a good day.